So good afternoon, everyone. My name is Aaron Salinas, and I am a nurse practitioner from the Rio Grande Valley. So today I have the unique opportunity to share a little bit about my story and some of the work that I've done in the Rio Grande Valley. So let me start off by telling you a little bit about where we are. We are located at the southernmost tip of Texas. We are in very close proximity to the Mexican border, and I've included an image on one of my favorite places here. It's actually a couple of blocks from the actual border in Reynosa. Um, so why the Rio Grande Valley? The Rio Grande Valley has been home to me, um, and I am very passionate about my community for many reasons. One of the most important thing to me is obviously family, right? We have a huge, rich culture. We are a very diverse culture. Yes, our area is predominantly Hispanic, but there is a lot of diversity, and also our warm weather, right? Our warm weather, and we are also known for citrus, right? The as far as grapefruits, as far as oranges, for many folks have considered our area, the citrus capital, because these these citruses do very well in our area. So I became interested in social justice. I'm not sure how many of you guys are familiar with colonias, and some of the challenges that we experience in not having sustainable living conditions. And I'm going to elaborate a little more on the next slide on that. So on this slide, you have a couple of pictures on some of the things that are near and dear to my heart. Right, we experience a lot of issues with flooding. We experience a lot of issues with pollution and how we deal with our sanitation issues in our community. And the other picture, kind of elaborates a little on some of the neighborhoods, and the you can see a lot. How they say a picture says a lot of words. I think that picture in the center really does. Um, some of the things that we have been, or my community has been recognized for at the national level, has been having recognized as having one of the fattest cities in America. You can do a quick Google, you'll see that. We have high numbers of uninsured patients. We have high number of patients that are have diabetes and hypertension, and end-stage renal disease, and not to mention we have one of the highest rates of high school dropout rates. As far as one of our neighboring communities in our area is one of the has some of the poorest income compared to the rest of the country. So these are facts. These are things that make my community unique. And so I talked to you guys about living by um, uh, living along the border, right? I mentioned in the previous slide a little bit about colonias, and colonias are substandard housing developments. I think when I think it's important that we all uh, have the opportunity to live in a safe environment. I went ahead and listed two events that had really had an impact in our community as a result of poor decision making, huge substantial impact in the health of our communities. And I think that I wanted to highlight on them, because that is where learning about this, taking care of patients that have had some sort of impact in these two events, is really what steered my passion for wanting to focus on various environmental issues, and how we as healthcare providers can make a difference and have a positive impact. So my story, I started off as a pre-hospital provider, as a paramedic, and that's really where I got like a bird's eye view of what are some of the things that happened. What are some of the living conditions, and that really should echo a lot of what I discussed in the previous slide. Um, I did a steer rotation. This was an environmental focused rotation. Huge eye-awakening, eye-opening experience. You know, it wasn't until I started really going into different areas along the Rio Grande Valley that I saw some of the living conditions, some of the, poor sanitation issues that we had, some of the poor plumbing issues that really a lot of some folks in the colonias don't even have plumbing. So goes to question a lot of the um, different types of issues that they had. And then as a fellow, had a lot of opportunities to really work with different groups in a positive way. Focused a lot on education, community advocacy, and really educate those folks on how to live a healthy condition. And a lot of it is steered around the work that I've done as a fellow, and that is something that I'm very proud to share.